All right, guys. Now, today we're going to be going over Royal Neighbors of America and their SIWL. Okay. So, this is a simplified issue whole life plan offered for final expense with no medical exams because it is simplified issue. They have a few ratings. They have a preferred, standard, graded, guaranteed issue with issue ages rating in between 45 and 85. Um, their preferred rating is 45 to 80. Their standard is 50 to 85. Their graded is 50 to 85. And their guaranteed issue is 50 to 80. Okay. And their face amounts range anywhere between 5,000 and 5 million. Um, so permanent coverage plan with level death benefits, no increasing or decreasing. Now, the preferred rating, this is for guys and gals that are really healthy. They might have a couple conditions going on, but nothing severe like diabetes. They could have diabetes, they just can't be taking an insulin. Okay, but we'll get into that. Their face amounts start at 25,000 and they go to 40,000. Now, for their standard rating, this is where we push folks with moderate health risks. Okay. Also, where we push folks that have a very high BMI or very low BMI because there's no height weight chart with Foresters, or not Foresters, Royal Neighbors. Their face amounts start at 5,000 and they go to 40,000. Now, they have a graded and a guaranteed issue rating, okay, which not a lot of companies have both. Now, their graded is a little bit different than your typical graded product. Okay, it does have a 2-year waiting period. But in the first year, the client's going to have 30% of their total death benefit. So if a client has a $10,000 policy, in year one, it's going to be worth 3,000. Okay. And then in that second year, it's going to be worth 70%, which is going to be 7,000. Okay. And then once that 2-year wait's over, it's going to be worth the full 10. Okay. So it's a great option for that situation right there. Um, the face amounts range anywhere between 5 and 20,000. Okay. And then the next is the guaranteed issue. Okay. Guaranteed acceptance, no health questions, nothing, just like our American General plan. It has a 2-year wait with face amounts ranging anywhere between 3 and 10,000. It's extremely expensive. We will almost never write it. But at least you know. So, a few riders and benefits that come with a plan with Royal Neighbors is their terminal illness rider, their chronic illness, their critical illness, and then their charitable giving. Okay. Now, a common case is that will push a case, be able to push a case preferred. Okay. And these are standalone. You can't have any two of these. Okay. You can either have, you can have AFib. Okay. You can have diabetes as long as you're not taking any insulin, non-systemic lupus, depression or anxiety, med dependent, can't have over, I believe, like 2 or 3 meds. You can have like one, maybe you take like Zoloft for depression. That one's good. Major depressive disorder like MDD, obviously med dependent. A lot of those cases will get pushed to standard, so be careful. And then cerebral palsy, which is huge. Now, there's a lot that'll push a case standard. Okay, and it's really the only reason why we use Royal Neighbors is because of their standard rating. Okay, it's the most common, no height weight chart, stuff like that. Okay, so with Royal Neighbors, if you have diabetes with insulin, but it won't take any complications. Like you can have diabetes with insulin, or you can have diabetes with neuropathy, but no insulin. If that makes sense. Like you can't have any complications with your diabetes if you're taking insulin. Um, Blood clots, a year plus, that's the window. It's a 1-year look back on blood clots. You can have bipolar, angina, a 5-year look back on cancer. You can have skin cancer or like just got rid of it, skin cancer. There's no look back on it. Um, Liver disease, COPD, but you cannot smoke. It's an auto decline if you have COPD and you're a smoker. So make sure you look out for that. Um, Heart attack, there's a 2-year window on that. They'll take Hep C, narcotics or narcos, um, like painkillers, stuff like that. They're kind of our garbage can as far as carriers go when it comes to those types of medications. Wheelchair use, but not wheelchair confined. There's a difference. Wheelchair use, maybe I broke my leg or something like that, or broke both my legs, whatever. And I'm in a wheelchair for a certain amount of time, but I'm not confined to it because it's for some of like chronic illness or something like that. Okay. They'll accept seizures, schizophrenia, uh, Parkinson's. They'll accept a pacemaker with a 1 year look back on that being installed. They'll take multiple sclerosis or MS. They'll take a stent in the heart or the brain, 2 year look back on that. And then stroke 1 year look back as well as TIA 1 year look back. Common cases that'll get pushed graded. Okay. 3 year look back on cancer. So between years 3 and 4, client had cancer, it's going to go graded. Okay. COPD with tobacco. So if without tobacco, you're good on standard. But if they are a smoker with COPD, you need to look somewhere else unless you're okay with their graded rating. Um, any diabetic complications, and they're taking insulin. Okay. The client can have neuropathy and still get a standard rating. They just cannot be on insulin, if that makes sense. Um, heart attack between 12 and 24 months. So obviously before 12 months, decline. After 24 months, we're good on their standard rating. So in between that, we're looking at a graded. Kidney disease, 2 year look back on them on kidney disease, and then stents. Where if we, anywhere between 12 and 24 months, we're looking at the graded rating or looking at another carrier. And then any TIAs from the moment they got it till 12 months later, that 1 year look back, we're looking at graded as well. Now, common guaranteed issue cases, really anything. Okay. If the client is fogging a window and they're in the ages of 50 to 80, they can get the guaranteed issue. It doesn't even matter. They could have AIDS, they could have anything. It could be in a wheelchair, have oxygen, um, stage 4 leukemia. It doesn't matter. They can get the guaranteed issue. But yeah, that's pretty much it with Royal Neighbors. They're really, we only use them for their standard rating because they accept so much. But they're a great product, especially if a client's a little bit heavier set. They don't have a whole lot of conditions going on with them, maybe just like some high blood pressure medications, stuff like that. That's usually where we can push them that way, or maybe you meet a midget. Okay, don't really like to use that terminology, but it's true. There are some small people out there that are under the typical BMI that we're looking for as far as carriers are concerned that might shy them away from like Mutual of Omaha if they're super healthy. So we can go to Royal Neighbors for them, okay, because they don't have a height weight chart for their standard rating, which is awesome. Um, but yeah, I will see you on the next one.